Hello radiographers, hope you are doing good. Welcome to a new tutorial video, and it's a barium swallow, a contrast X-ray of esophagus. So let's start. So at first, what is barium swallow? So let's see the definition. A barium swallow test is a special type of imaging test that uses barium and X-rays to create images of your upper gastrointestinal tract. That means you have to visualize the patient's esophagus from mouth to gastroesophageal junction, and for this we have to use contrast agent. Your upper GI tract includes the back of your mouth and throat, that means pharynx and your esophagus. So that's the definition. So barium swallow means you have, this is the a contrast X-ray of esophagus. You have to visualize the esophagus from mouth to gastroesophageal junction. And now let's look at the anatomy first. The anatomy for esophagus or barium swallow, we have to start from the mouth and then pharynx, then this is behind the trachea, and then esophagus and to the stomach. And this is the stomach, and you know that this is the small intestine and large intestine. So this is the GI tract, but for barium swallow, our target is mouth to stomach. And now the indications. What are the indications and when doctor advise this barium swallow? So the first one is dysphagia. So dysphagia means difficulty in swallowing, and there may be various reasons like cancer, stricture, and varices of the esophagus, and then a hiatus hernia, then esophageal reflux disease, and any foreign body, suspected foreign body in the esophagus, and when patient vomit with blood, and when patient weight is lost, when patient lost his weight, and esophageal ulcer or polyp. So these are the conditions, indications for barium swallow study. And what are the contraindications? Contraindications means when not to perform this procedure. When the patient have recent esophageal or gastric surgery. So recent esophageal and gastric surgery is contraindicated for barium swallow, and then suspected perforation. That means if there is suspected leakage in the esophagus, and that will be a contraindication. And then tracheoesophageal fistula. So if there is a fistula, or if there is a connection between the trachea and the esophagus, so this is a contraindication. And if the patient have complete bowel obstruction, it is a contraindication for barium swallow study. So now let's see what are the equipment needed for this procedure. So first we need a fluoroscopy unit. That means we need a X-ray machine with fluoroscopy unit, so that we can see live images of the GI tract, and when the contrast goes down, we can see live in the fluoroscopy. And then tilting table. That means the table can rotate an angle, and obviously the contrast, and this time the contrast is a powder, and it's a barium sulphate powder. This is a white color powder. Then mug and spoon and water. So these are needed to make paste of the from the powder, and this paste will be given to the patients to eat. And then gas producing agent, that is double contrast study. So sometimes doctor advise double contrast study. So then we have to provide some medicine so that it can produce gas. So I will discuss it later. So contrast media is, this is the contrast media we use in our department, and it's a water insoluble barium sulfate. That means the barium sulfate doesn't soluble with water, but we mixed with water and make it a paste. And if we need double contrast, then we need air. So this is a barium sulfate powder, Bugard powder, and it's a 150-gram powder, and it retains X-ray examination of gastrointestinal tract. So you can use what is available in your region, but the main component is the barium sulfate powder. And why barium sulfate powder is used for this examination? So you can see that this is the barium sulfate powder. It's like some kind of flour. So barium sulfate powder is have the ability of excellent coating of mucosa. So barium sulfate can coat our mucosa. It is a layer of our GI tract. It can coat excellently, and lack of absorption in the gut. So it's take time to absorb in the gut, and lack of toxicity, radiopaque material. So obviously barium sulfate should be a radiopaque material, and that's why we can visualize it on the X-ray, and X-ray cannot pass through this because it's a radiopaque material. And then water insoluble. So because of the water insoluble, it is not soluble with the water, and high density. So barium sulfate has high density, and that's why it's a radiopaque material and provides a positive contrast X-ray. So as it's a radiopaque material, it should provide a positive contrast X-ray. But if we need negative contrast, then we use air or gas producing agent. So go to next slide. And preparation needed for this procedure. Ask the patient not to eat or drink 2 hours before the procedure. So patient need to fasting for 2 hours before the procedure, and psychological preparation just explain the procedure to the patient. So explain the procedure to the patient that you have to swallow some kind of paste, and it's a little bit uh, sweety in taste. So explain the procedure and when to swallow the paste, and if the vomit come, what he do. This will be explained. And remove clothing and wear hospital gown. So patient should remove his personal clothing and wear hospital gown, because her clothing may have radiopaque material, and his personal dress can be damaged by the barium sulfate paste. So always wear hospital gown to the patient. And here you can see that no coffee and no food, no burger. That means no food or drink. And now the procedure starts. So we have to take a preliminary film. That means a non-contrast film of the neck, including mouth and upper chest. And this is the anterior posterior esophagus and lateral esophagus. So we have take two film before giving the barium sulfate to the mouth. One is AP and one is lateral. And these two film will work as point of reference and establishing positioning and exposure factor selection. And now we have to know the technique of this patient positioning and how to give the patient the contrast, barium sulfate contrast. The first patient is placed in the erect and upright position. So take the patient to the fluoroscopy unit and tell him to stand upright on the footpad and make a paste of barium sulfate. In the meantime, you make a paste of the barium sulfate. That means mixed with water, mix the barium sulfate powder with water so that it is not so fluidy. That means it's not so watery or not so hard. So it will be like a paste, and give 2-3 spoons, one mouthful of barium sulfate paste into patient's mouth and ask to hold it. So after taking the control X-ray, then give him 2 or 3 spoons of barium sulfate paste and he should hold this and not to eat. And then patient is asked to take several swallows of barium sulfate suspension. And then patient asks the patient to swallow the barium sulfate, and in the meantime you take the X-rays and observe the passage of barium in fluoroscopy monitor and take images of esophagus to stomach. So when the patient is swallowing the barium sulfate, then monitoring the passage of the contrast, the how it goes down to the esophagus, and try to make images of the whole esophagus in different position. Like one is spot frame AP, and then lateral, and then the left posterior oblique. So this is the position you can see here. This is the left posterior oblique position, and patient is swallowing, and radiographer adjusting his tube and also watching on the fluoroscopy monitor. And if double contrast technique is advised, then what you will do, you can see in the image that there is gas in the esophagus and also barium sulfate. So patient in upright position, and injection buscopan is injected to begin. So this buscopan is injected to reduce the function of the esophagus, and gas producing tablet is given in another mouthful of barium sulfate to patient. So for producing gas, a calcium tablet is used and is given to the patient, and the patient should not burp after swallowing the barium. And then barium is given, barium sulfate, and he swallow the barium sulfate, and in the meantime gas is produced in the esophagus, and then patient is asked to take several swallows of barium sulfate suspension and observe the passage of barium in fluoroscopy monitor and take images of esophagus to stomach. So when patients swallow a calcium tablet and barium sulfate paste, and that will make a double contrast in the esophagus. You will see that this is the double contrast, the barium and gas is visible, and here is the single contrast. There is only the barium sulfate powder, and here is the gas mixed with the barium sulfate. And the position is AP lateral and left posterior oblique. So these are the films for the barium sulfate, barium swallow. This is the AP view. So in AP view, we can see that the image is taken from the pharynx to the gastroesophageal junction, and also in the lateral view. And in this AP view, it's taken from the mouth to the mid heart, and also this is the oblique view, left posterior oblique view. So these are the views you have to take for this procedure. And here is another view. This is the anterior, the posterior view, AP view. You can see the esophagus is straight enough, and there is a thoracic vertebra also visible. This is the esophageal junction, and this is a right anterior oblique view. This is the esophagus, thoracic vertebra. This is heart. So you have to take several views when swallowing the esophagus, like anterior, posterior, lateral, and oblique. And there are some complications of barium swallow procedure. These complications are, one of the complication is aspiration. So aspiration means that the patient may have breathing difficulty because the patient may feel that the barium sulfate powder goes into his lungs through the trachea, and leakage of barium from unsuspected perforation. So the esophagus may have perforation or may have leakage. So the contrast barium sulfate paste can be perforated through this leakage, and the most of the common perforation may be tracheoesophageal fistula, where the barium sulfate contrast goes to the lungs and patient feel difficulty in breathing and aspiration. And then constipation, that means the patient may have difficulty in evacuation. And after care for this procedure is drink plenty of water. That means ask the patient to drink plenty of water after this procedure, and inform the patient about the chalky stool. That means the patient may have stool, white stool, and patient may feel nervous and anxious. So after the procedure, explain that you may have chalky stool, so nothing to worry. So these are the complications and aftercare. So thanks for watching. This was a short tutorial for on barium swallow procedure. Hope you like this video. Please hit the like button and don't forget to subscribe my YouTube channel, and of course hit the bell icon. So thank you and see you in the next tutorial.